Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Carlos Nunez. He's a physician executive. Today's Kevin MD article is Why Sleep is the Missing Pillar in Modern Healthcare. Carlos, welcome to the show.
Thank you, Kevin. It's a pleasure to be here.
All right, so let's start by briefly sharing your story and then talking about the article and why you decided to write it.
Sure. So, as you mentioned, I'm a physician, but as an executive in the corporate world, do not practice clinically anymore. I was in clinical practice. I'm an anesthesiologist and intensivist. But if you look on my Discord profile, it'll say, should have been an engineer, went to medical school instead. I'm super nerdy, always just enamored by technology, and eventually shifted into industry, started working for different medical technology companies, finding ways to use technology to improve clinical care for patients. The company I work for now, for which I'm the chief medical officer, is a company called ResMed. We're the largest provider of respiratory and sleep technology that people use in their homes. And it's an amazing space to be in because, as you mentioned, sleep is such an important part of human health.
All right. So before we talk about your article, now just wanted to tap into that industry side for physicians who may be interested in getting into that health tech industry. What would you say is the single biggest piece of advice for those doctors?
Find something that you love that is adjacent to your practice of medicine and find the career and industry that exploits that. If I was working as a research physician at a pharma company, I'd probably do a good job, but I wouldn't be happy because that's not my passion. My passion, as I said, was technology. So finding a role within that health tech, med tech space has become extremely fulfilling for me. When I was practicing as an anesthesiologist, I could take care of one patient at a time. As an intensivist, I could take care of 10 or 20 in the ICU. But I do things today, I may make a decision that can help millions of people breathe better, sleep better, live happier, healthier lives. And so it's become an extremely fulfilling career for me. I'm still involved in clinical work. My medical affairs team, the medical affairs team that I lead, does a significant amount of research with key opinion leaders around the world. I'm the co-author on an article that was just published 2 days ago
Mhm.
in the Lancet Respiratory Medicine. So I get the best of both worlds, and I get to have a job that allows my passion to really be my career. And when you love what you do the way I do, it doesn't feel like work. It feels more like a calling.
Your Kevin MD article is titled Why Sleep is the Missing Pillar in Modern Healthcare. Tell us about that article for those who didn't get a chance to read it.
The article is so important to me personally, but I think to physicians and also to our patients because we have three basic pillars of human health. There's sleep, there's nutrition, and there's physical activity. We have, and forgive the term, but in society for the last several decades, fetishized things like diet and exercise. We talk about those all the time, but it feels like now finally sleep is having its moment. Of those three pillars, if you don't sleep well, you don't feel like going to the gym.
Hmm.
You don't make the right choices to pick foods that are healthy for you. As one of my colleagues likes to say, no one craves a salad at 3 a.m. in the morning, right? When you sleep well, you are giving your body a chance to heal and recover from the day, from the stress on the physical parts of your body, but also your mental
Hmm.
well-being, your brain health. And we take it too much for granted. We wear it like a badge of honor. Physicians, for example, we're used to things like internship and residency. I'm always tired. No big deal. I learned to survive on 3, 4, 5 hours of sleep. Well, now we know that every night that you do that, you're damaging your body, you're harming your brain. And we understand that poor sleep leads to higher risks of things like cardiovascular disease,
Hmm.
dementia, Alzheimer's, erectile dysfunction in men. So there is so much that we still don't appreciate about sleep, and we don't emphasize it enough in many of our clinical practices.
Now, despite the greater awareness that we have about the harms of lack of sleep, why do you think so many people still accept poor sleep rather than seek help about it?
It's interesting. As I travel the world in my job, ResMed is a global company and we do business in 140 countries. And I've had the pleasure of visiting physicians and hospitals and health systems around the world. And I'm struck by what they say. And a lot of it is cultural. For
Mm.
example, a few months ago, I was in India talking to physicians in Mumbai, and in society there, a good sleep is when you're snoring and it sounds like you're just deep in sleep. But actually, a lot of those folks who are snoring that way may be suffering from a sleep disorder like sleep apnea and not sleeping well. And again, then there's that society, that hustle culture where it's like, nah, sleep 3, 4 hours, or the joke, you'll sleep when you're dead. Yeah, well, you might sleep when you're dead if you don't sleep well while you're alive, because again, it increases your risk for so many comorbidities.
So tell us some of the misinformation that people are seeing about sleep disorders. I'm sure we have so many things on social media that patients come to me about, but from your travels and your experience, what's the biggest misconception that people have about their sleep or lack thereof?
A couple of things. The first is that most sleeping problems, people suffer from, basic, simple bouts of insomnia a few nights a week or whatever, can't be taken care of simply. The vast majority of people who have some trouble sleeping, if they just stick to basic sleep hygiene, go to bed at the same time more or less every day, wake up the same time more or less every day, and make sure you're sleeping in a comfortable, dark, quiet space, those simple things help so many people. However, because problems while you sleep, including sleep disorders like sleep apnea, happen while you're asleep, you don't know.
Mhm.
So you should listen. If you have a bed partner, listen to your bed partner, or listen to your body the next morning so that you can ask your physicians questions. Why am I always tired? Why do I wake up with headaches? Why do I wake up drenched in sweat? All those different signs and symptoms of different sleep disorders. And then physicians, our colleagues, need to learn a little more about sleep medicine than we typically do in medical school. The average US physician only gets a few hours of sleep medicine training in school. So if you don't go into internal medicine and or sleep medicine as a fellowship, you won't get much more training. So we need to learn how to speak to our patients when they ask, how we can respond, or what are the follow-up questions we should ask. Because the thing that bothers me the most is a condition that I deal with, sleep apnea. I've mentioned it a couple of times, but it is a condition that affects 1 billion, that's with a B, humans, but 80+% are undiagnosed and untreated. And it's one of the most devastating sleep disorders because it completely fragments your sleep and also deprives your tissues, including your brain, of oxygen multiple times over and over every hour. And it's a condition that it seems like we're not doing enough to find those patients because they deserve treatment. They deserve the different options that are out there.
Now let's get everyone on the same page. Tell us a little bit about what exactly sleep apnea is and the consequences of sleep apnea going untreated or undiagnosed.
Sure. So I'm gonna do a little play acting here. So sleep apnea is a condition that, as I mentioned, affects 1 billion people, and most are still untreated. And what happens when we sleep, as we all know, our muscles relax,
Hmm.
including the muscles in our upper airway, in the back of our throat. And in 1 out of every 8 people, those muscles will collapse to the point where they obstruct the airway. It's called a condition, not a disease, because it's multifactorial. And it's also a consequence of us being human. The fact that we evolved the capacity to sleep, which makes our soft palate and our tongues more flexible, makes us more predisposed to snoring and obstruction. When you obstruct, I'm going to do a little play acting here.
Hmm.
So you may go from snoring to what sounds like gagging, choking, or gasping for air. So this is what my wife would hear before I was on therapy. I would be like, and after about 10 seconds, as your oxygen saturation starts to drop, your brain has a little freak out moment. Hey, maybe we're suffocating. We send a little rush of adrenaline through the body. You get that little spike of epinephrine. Your heart rate jumps up, your blood pressure jumps up for a second, and you take a good deep breath. But it's not enough to wake you up most times. And so a sleep apnea patient like myself will stop breathing like that to where they start to desaturate multiple times an hour, every hour they sleep. Now, you asked about the consequences. So, untreated sleep apnea is a very, very serious condition. There is really good research that's been published in just the last few years that shows that untreated sleep apnea increases the risk of all cause mortality
Hmm.
by 35% and cardiovascular mortality specifically by 55%. I alluded to things like erectile dysfunction in men, and the one that scares me the most is dementia. You can only imagine, so someone with mild to moderate sleep apnea may stop breathing 15 times an hour. That's considered mild, right? 15 is when you get into the moderate range. That's a lot of suffocating. So can you imagine if every hour you sleep, every 4 minutes, you're suffocating? You
Mm-hmm.
would never tolerate that while you were awake. Imagine if you held your breath every few minutes till you turned blue and you had to live your day like that. Well, that's how you're living your night. And your brain is suffering because it's not getting as much oxygen. And then it's suffering those adrenaline rushes that spike your heart rate, spike your blood pressure over and over. It's literally just a barrage of physiologic insults that happen all night, every night. Happened to me until I was, finally out of the denial phase. I was the typical doctor. I'm
Mm-hmm.
always tired. I can live on 4 or 5 hours of sleep. And then my wife finally put her foot down. And yeah, so I have sleep apnea and I sleep with a CPAP machine every night.
So, how about in a primary care setting in which I practice in? Tell me the types of questions I should be asking or symptoms I need to recognize to make me suspect sleep apnea.
So I it'll never become a thing, but I always use these three letters to remind me of the three most important questions, QTS. It's the quality, the time, and the schedule.
Hmm.
So ask patients, just overall quality, how is your sleep? And that is a good open-ended question. They'll start to tell you where they think they may or may not have problems. The second T, time, how many hours on average do you sleep? And then S, the schedule. What time do you usually go to bed and what time do you usually wake up? And it all refers back to that sleep hygiene that I mentioned earlier, that is the easiest way to help most people get back on track with their sleep. But if you ask those questions and they deviate from the typical sleep hygiene, they mention that they are excessively tired, fall asleep at a red light, fall asleep watching TV every night, can even fall asleep at work. I mentioned waking up with headaches, waking up
Hmm.
drenched in sweat, dry throat, scratchy throat. Those sorts of things are all giveaways that you're not sleeping well. Maybe it's sleep apnea, maybe it's insomnia, but asking those questions. If we believe that sleep is so important and knowing in the primary care setting that time is so limited, it should almost be some of the first questions that you ask, right? Sleep should be almost like a vital sign, if you will.
Now, way back whenever we suspected sleep apnea, we'd do one of those overnight sleep studies in a sleep lab. But what is standard of care now? I know that we have a lot of technology when it comes to diagnosing sleep apnea. So tell us some of the options that are available to patients today.
Absolutely. So you're right. The in lab overnight sleep test still exists, and it is still often used for very complicated cases where people might have, a sleep disorder that is not just obstructive sleep apnea, but maybe mixed with central. Maybe they have narcolepsy. There are all sorts of reasons. But for suspected obstructive sleep apnea, I hate using the term run of the mill, but the most common form, the rise of the home sleep test has been quite impressive over the last couple of decades. More than half of tests in the US now are done at home.
Hmm.
And the smallest home sleep test devices are about as big as a piece of chewing gum. It's like something that'll sit on the end of your finger, wrap a little band-aid looking piece of tape, sleep with it for a couple of nights, throw it away when you're done, and your doctor gets all the data through the cloud and can make the diagnosis. We also see that some of the big tech players, Apple and Samsung in particular, have announced that their smartwatches, which announced last year, their smartwatches can detect sleep apnea. It's not considered a formal diagnosis,
Hmm.
but similar to the AFib detection that we see on some wearables, it's enough of a screening and detection device to raise it with your physician. Funny anecdote, my mother, who I know has had sleep apnea for decades and refused to listen to me because who knows, I'm just the doctor that she paid for all that medical school.
Hmm.
But she got an Apple Watch last year for the fall detection because she's elderly, and it told her she had sleep apnea. And now she's got an appointment with her primary care to get a sleep test. So she don't want to listen to me, but boy, she did listen to her Apple Watch.
Now, once someone is diagnosed with sleep apnea, you mentioned a CPAP machine. Is that the only option? Do we have other modalities other than CPAP machines?
There are multiple options. CPAP still is the gold standard. It's the one therapy that works for almost everybody every time, and it alleviates the apnea immediately. And the good thing about a CPAP device, for those who think about them, you probably think about
Hmm.
your father's or your grandfather's generation of CPAP devices. The new ones are much smaller, quieter, comfortable, connected to the cloud, apps, all of that great stuff. But there are other options. Some people do not tolerate CPAP. There are what are called mandibular advancement devices, where they reposition the mandible forward to try and pull the tongue off of the back of the throat, the back of the upper airway. That works for some people, especially in milder cases. It's not without complications. It
Mhm.
can cause tooth movement, jaw pain. There are implants. There are hypoglossal nerve stimulators that are implanted like pacemakers that are also an option for some people. They are expensive and there's a lot of insurance qualifications, as you can imagine, to get a surgical procedure, but they do work for some folks. So those are, sort of niche alternative therapies. There is also a lot of discussion around GLP-1s. There is a GLP-1 with an indication for obstructive sleep apnea and obesity. And obesity is associated with higher incidence of obstructive sleep apnea, but it is not the majority. It's a misconception to think that most people with sleep apnea have it because they're overweight. Some do have worse sleep apnea because they carry extra pounds, but a GLP-1 can be useful to help manage weight. So if you do lose weight, your sleep apnea can become less severe, and then it's easier to treat with something like a CPAP or another therapy.
Now, for patients, in terms of what they should be looking out for, you mentioned sometimes their partner may describe that they may be snoring or gasping for air at night. Now, what about things like daytime sleepiness? Because that's the proverbial symptom that brings people in for sleep apnea. What do you think about that or any other symptoms they should be looking out for?
Yeah, over daytime somnolence and being, that sort of unnatural being sleepy in an unnatural way is what you really want to look out for because the I don't say it like this, but the good thing about people who have that symptom is that they see almost immediate relief from
Hmm.
CPAP therapy. And so it's easier for someone to stay on therapy when they notice a difference. If someone is actually asymptomatic, which does happen, you can have sleep apnea for years and you live with it just fine, or at least you think you do.
Hmm.
It's harder because you're like, okay, I have this therapy, I'm sleeping with this device, or I have this mouthpiece, or we went through the surgery, but I don't feel different. And so it's harder for patients to understand that the benefit when they don't feel a difference. But yeah, look out for the daytime somnolence is really an important indicator. But then I mentioned some of the others, waking up with a scratchy throat. That's a sign of, strong snoring and potential obstruction. Waking up with headaches, waking up drenched in sweat. That was mine. I never understood why sometimes I would just wake up completely drenched in
Mm.
sweat. And that was the symptom. That and my wife, well, the bruising from my wife hitting me with her elbow saying, "You're snoring."
We're talking to Carlos Nunez. He's a physician executive, and today's Kevin MD article is Why Sleep is the Missing Pillar in Modern Healthcare. Carlos, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think the most important one is don't don't sleep on sleep. Understand how important it is. Do a little bit of research if you're
Mhm.
not familiar with the basics of sleep medicine. So when your patients ask questions, or more importantly, when they don't ask questions and you need to get to the bottom of why they might be feeling the way they do, understand how important sleep is. The second thing I would say is obstructive sleep apnea is a really significant condition that is way underdiagnosed. And the misconceptions about therapy and adherence to therapy are dated, decades
Mhm.
old. And so don't be afraid to ask the questions about sleep apnea. You don't have to send someone for an overnight sleep test anymore. They can actually, in the comfort of their own home, get a real diagnosis.
Carlos, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin. It's always a pleasure to hear you. And now I'm on the show. So it'll be a pleasure to say that I got to be a part of what's such an important resource for physicians around the world.
Thank you so much, Carlos.
Take care.